Hello and welcome to Rappler Talk. Today we're joined by Dr. Hart. He's the Department of Psychology Chair at the Columbia University of New York City. His research interests include behavioral neuroscience and neuropsychic pharmacology. He's an expert on the effects of psychoactive drugs, and recently he gave a talk at the University of the Philippines, Diliman, to debunk myths about drug use and its effects on people. So thank you for joining us, Dr.
Thank you for having me.
Maybe so people understand, maybe you should talk about how you ended up in this as an expert in the field of legal drugs, I guess.
Yeah, so I actually became interested in drugs because I came from a community in the United States, a resource-poor black community where in the early 80s we were told that crack cocaine was destroying our communities.
Okay.
And so I thought I would study the neurobiology of drug addiction. And so if I figured out how to cure drug addiction, I could solve the problems related to crimes, unemployment, violence, all of those sorts of things. But as I went through my studies over the past 25 years or so, I have learned that many of the assumptions that we hold about drugs are just simply not true.
Right.
So that's how I came to where I am today.
I think that's one of the things that you said during the talk, that drugs, oftentimes, it's not the problem or it's not the only problem. Maybe you can expound on that also.
Yeah, let's just go back to, let's say, the mid-1980s in the United States.
All right.
We thought that crack cocaine was responsible for high rates of unemployment. We thought that it was responsible for high rates of violence, all of these sorts of things. What we discovered is that higher rates of unemployment occurred long before crack cocaine was there.
Okay.
Crime was already there. And so we were blaming crack cocaine for these problems that were already there, and we weren't thinking about it critically. And then once we started to look deeper, we started to see that there were other issues like unemployment, undereducation, substandard healthcare. All of these kind of things contributed to the problems. But when we simply looked at crack cocaine, we were not sufficiently equipped to deal with the problems of the community. And so as I think about the situation that happens here today, as well as other places around the world, it's easy to blame one drug.
Right.
But the problems are far more complicated than that. And that's all I'm trying to do, is trying to ask people to think beyond the drug and look deeper. And if we look deeper, then we can help our communities.
Interesting that you mentioned that, because the narrative that a lot of policemen, a lot of locals, especially in poor communities in the Philippines, that's what they experience. Like, shabu is the reason why crimes are happening, why my daughter was raped.
Yeah.
You know, so but how do you, like, if that's your experience as a person, how do you, and then science tells you otherwise, how do you reconcile that?
Well, it's a difficult thing because on the one hand, when people are hurting because they had a crime perpetrated against them, we want to respect that on the one hand. But then on the other hand, we want to make sure we help them solve the problem, the real problem. For example, if we understand that shabu is a medication that is prescribed in some cases, and that means that there are people who take the medication as part of their treatment for attention deficit disorder. It's also prescribed for things like obesity. Now, if we understand that most of the people who take this drug do not engage in rape or whatever heinous crime we are worried about, then it requires us to look deeper, and then we can figure out how to stop those things from actually happening.
Right.
Because if we're simply blaming the drug, we can rid the community of that drug. It'd be difficult, but we can focus our efforts there. Rape will still be there.
Right.
Violence will still be there. And so I like to solve the real
actual
problem.
Yeah, the
Yes.
actual problem.
Yes.
One of the myths that you debunked during your talk at UP was that methamphetamine or shabu shrinks the brains of
Yes.
users. Maybe you can explain the science behind that, because it was very controversial, especially because President Duterte has repeatedly made that assertion in his public speeches.
The myth of methamphetamine shrinking the brain, it's not a controversial myth. Anybody in science knows that that's not true. I mean,
Okay.
there's no psychoactive drug taken at the doses that humans take will shrink your brain.
Right.
If it does, it will kill you long before you take another dose. And there's no scientific evidence showing that Shabu shrinks anybody's brain. And so when people make statements of that sort, you just want to ask them to please show you the data.
Right.
It's remarkable to me that that's even
A debate?
a belief, because there are serious concerns with Shabu, that we don't have to go and deal with those myths. For example, I worry, for example, as a scientist, if people are taking Shabu or methamphetamine chronically, long term, I worry that they're disrupting their sleep. That's one of the real things that it does. And if you disrupt your sleep,
That's another.
and then you can have
lot
some
of
psychiatric
problem.
problems. I mean, if you continuously disrupt your sleep. So when we focus on these myths, it takes away attention from the real
I
concerns.
see.
And so I like us to focus on the real concerns and not these myths.
There was backlash over that talk that you gave, not during the conference, obviously, but on social media, when people heard about it. Did that surprise you, that people were resisted the information that you gave?
Well, social media, there was a famous cartoon where there were two dogs on the internet, and then one dog said to the other dog, looked at the other dog and said, they don't know you're a dog on the internet. So when you are dealing with social media, you don't know if there are people who are paid, you don't know whether this is genuine. And so I don't really pay attention to that sort of thing. The thing that concerns me most here is that the medical community, not all, but many members of the medical community have not come out and asked people to focus on the real concerns and not these myths, because this is well documented. The real concerns about methamphetamine, we know, and we've known for a number of years. Like this notion of this drug shrinking your brain, that's not a real concern. And the medical community knows this. And so for them not to help the people focus on what the real issues are, that's the thing that surprises me and disappoints me.
Is this new for even experts, supposed experts, or people who should know better, to reject or to
Ignore.
ignore studies?
No, this isn't new. This happened in the mid-1980s in the United States with crack cocaine. It happened in Brazil in the early 2000s. It happened in Thailand in the late 1990s. So this isn't new, but one of the things that happens is that once people start to hold, for example, the medical community accountable, and they ask people, it's like, that's great, you have that opinion, you have that view, please show me the evidence that supports that view.
All right.
And if we start to require people to have evidence to support their view, then maybe we can start actually helping people.
Another thing that you said during your talk was that not all drug users are addicts, which is, again, it might run contrary to a lot of experiences here in the Philippines. When they see someone use shabu, for example, they say, addict yan, that's an addict. So, I mean, can you explain that for people who might be wondering what you mean when you say that not all drug users are addicts?
Yeah, let's take a drug like methamphetamine, right? Methamphetamine, or shabu as you all call it illicitly, amphetamine, it's essentially the same drug that in the U.S. military, for some soldiers, we prescribe this medication, particularly for soldiers who work extended periods.
Okay.
They are some of the most responsible people in the world. In some cases, they have billion-dollar aircrafts that they're responsible for. And so for people to say that these people who use amphetamines are addicts, that would be ridiculous. And then, on the other hand, we also have people who are prescribed this medication for attention deficit disorder, people who are prescribed this medication for other things, who are responsible people who you cannot call an addict. So, but by the same token, there are people who do use the medication in a way that meets criteria for addiction, and we should be concerned. But we cannot conflate the two, because the two are not the same. There are people who, they absolutely abuse drugs and they meet criteria for drug addiction. But then there are other people who use the same drug who do not. They're responsible people. They take care of their families. They are living, they are upright citizens,
Right.
and we respect them. They are pillars of their community in some cases.
What's the difference? I mean, people you are. What is the difference between someone who's just
Yeah.
I don't know if that's the
Yes,
way
yes,
to
yes,
just a user or someone who's actually a drug addict.
Let's think about drug addiction. When I use the term drug addiction, I am referring to the International Classification 10 definition as well as the Diagnostic Statistical Manual's definition. That definition basically says your drug use has disrupted your psychosocial functioning. Like you're not going to work, you're not going to school, you're not meeting your obligations, you're spending all of your time engaging in that activity. You have repeatedly tried to cut down and you have failed. You used a drug in situations that put your physical self in harm. All of those, so you have to endorse those symptoms in order to meet criteria for drug addiction, is how I use the term.
Okay.
Now, there are people who can use these medications for treatment or something, and they're not. In fact, it helps them to meet those
Right.
obligations.
Right. In the Philippines, one way people, the police in particular, account for drug users, they call them drug users, not addicts, is oplantokhang. I'm not sure if you're very familiar, but they knock on the doors of suspected drug users and they list their names, tell them to, sometimes there's rehab, sometimes it's Zumba. It depends on the limitations of a local government, for example. So is that a problematic scenario, you think, from a public health policy standpoint?
Is that a problematic scenario? Absolutely, yes. I'm learning. I'm still learning about the situation in the Philippines. The most important thing that we are concerned about when we are trying to help people who potentially have drug addictions is that we give them a careful assessment to
Right.
determine whether or not they have disruptions in their life. That's
Right.
one.
Okay.
And then we try and figure out, like, where are the problems? Some people, in some cases, for example, they may have co-occurring psychiatric or other kinds of illnesses
Okay.
where their drug use is being driven by those
Something
psychiatric
else,
illnesses.
right.
And so if you treat those illnesses, then you get rid of the drug addiction. In some cases. In other cases, people are addicted for other reasons.
Right.
But it's the responsibility of the therapist, the person who's doing the assessment, to figure out what's going on with that person. That's one of the things. But I think in the Philippines, a major concern is this issue related to crimes. Like we're concerned about people who take shabu or methamphetamine and then engage in some sort of horrible crime.
Yeah.
We all should be worried about that, obviously. But the point here is that we should focus on the crime itself, and we should deal with the crime just like we would if persons were not using shabu.
Right. So
Because-
it should be divorced from the fact
Absolutely. Because if someone commits rape, for example, I don't care if they're taking shabu or they're not taking shabu. They should be prosecuted and they should be dealt with. But when we point to shabu like that's the problem, then we're not dealing with the rape.
the whole public safety
Exactly.
issue, the crime issue. There's a quote on your profile that says, "Science should be driving our drug policies, even if it makes us, obviously, it makes a lot of people uncomfortable." So, is this an experience worldwide, not just here? I mean, obviously here you
Yeah.
experience it firsthand, but like,
Yeah.
does it happen in other countries?
Oh, yes. This is not unique to the Philippines, this sort of concern, because when we think about drugs, most of the people in a society do not know enough about drugs.
Okay.
And so drugs become an important political football. So
Okay.
you can galvanize support by talking about drug issues, and you can manipulate people based on the drug sort of issue. And so one of the things that we try and encourage people to do is to use evidence to support whatever position you have. I don't really care what positions people take. I only care that they have good evidence to support their position.
Those policies that they make.
Yes.
What kind of person should be handling all these surrenderies? We call them surrenderies, people who basically local officials and the PNP gathered the drug users nga through Oplantokan. Who should be handling them? Who should be assessing them, categorizing them? Addict, you're a user. I mean, who should be doing these things?
First of all, I don't know if you have enough resources to handle all of the
Okay.
surrenderees. And I think
Right,
that we
right.
should think about the term surrenderees. I mean, obviously, if somebody has committed a crime and they surrender, great, we can deal with that. That's something but you're talking about having people who use drugs and not have committed a crime other than
There
that.
is no, yeah.
Let's think about traffic, for example. There are people who violate traffic laws here all the time. I was just in traffic. Do we want to have them surrender as
Right.
well? It would overwhelm the system. So when we think about who should be evaluating these folks, we should have people who are experts in drugs, who understand something about problems related to drug use.
Right.
So you can appropriately assess what's going on in the situation and how to best serve the people who surrendered.
Right. Why do we demonize drug use? Like, when did that? I'm sure that happened long,
Yeah.
long before. I mean, what made society decide that drug use is an evil thing?
Yeah, that's a great question. One of the major reasons that we demonize drug use is because it provides an easy way for us to separate us from them, us being the good people and them being the bad people. And so we think about Shabu in this context. Shabu users are bad. We are good. And so if we take away that, if we say, wait, that's not necessarily the case, now is not as black and white, and it's
Right.
not as simple for people. And I think that's troubling for people because they want to have that ability to differentiate the good people from the bad people, particularly in nations that are religious, Christian nations,
Okay.
Muslim nations. It's not really good to vilify people. But if you say this is an evil that they're engaged in, now your religion allows you to vilify them. And
Because they're bad.
Exactly.
They're doing something
because
bad.
they're bad. Exactly. And so Shabu functions as that it functions in that role here. It allows people to differentiate the good people from the bad people, which is overly simple and inappropriate.
Right. It simplifies an obviously very complicated
Yes.
issue.
Yes.
I think one of the
It's not that complicated. It's really not that complicated because if we think about the body, and in this society we use alcohol, yes? Alcohol is a chemical just like methamphetamine or Shabu. The body does not distinguish whether or not this is a bad chemical or a good chemical. The body, there's a receptor that these drugs interact with. We as humans make that distinction, not the body. And so it's an artificial distinction that we make.
that society made. I
That
guess,
society
at
makes.
one point.
And that doesn't mean that society should not regulate these things. That does
Right,
not mean
yeah.
that. It just simply means that we should do it dispassionately and figure out what's the best way to move forward for our societies.
I think another belief that a lot of Filipinos have is after a certain number of years that you take Shabu or any other drug, you're beyond help. Like you can't. What's the science behind that?
There is no science behind that. That's just
Okay.
it's frustrating and disappointing and
Okay.
disheartening because on the one hand, we have seen people who had troubles in their life correct the mistakes, particularly young people. They
Right.
may have mistakes early on. They correct those mistakes and then they go on and make important contributions to their society. Let's just think about the last three presidents of the United States. All three, George Bush, Bill Clinton, Barack Obama, all three of those guys used illegal drugs when they were young men. They all went on to serve their country admirably.
Right.
You know, we can disagree with their policies and so forth, but we cannot disagree that they served their country to the best of their ability. And they made contributions to their country. Now, if we would have said that they don't deserve another chance, we would lose out on their potential to serve society.
Right.
And so I believe, and I hope that we believe, that everybody deserves second chances and that we don't just throw away people because we may be missing out on them making a contribution. That's important.
I think a common response people have, at least in the Philippines, when you criticize the existing policy, they'll shoot back. What's your solution? Like,
Yeah.
I mean, like, this is what the
Yeah.
government now
Yeah.
is trying to do.
Yes.
You say it's wrong, so what should they do? I mean, from a public health perspective, what should be done?
Yeah, I would be happy to advise whoever was willing to listen. I've talked to the Thai government, I talked to Brazilian government, I talked to governments in the U.S. A number of people. I'm happy to help. I mean, number one, we have to first distinguish between drug users and drug abusers. That's number one. We have to make sure we're careful about that sort of thing. And then we have to look at these things dispassionately. We have to stop vilifying people. And then we have to decide, okay, what are our major concerns? If our major concerns are crimes, great, we should be concerned about some crimes. Let's actually get some real good evidence about what is the percentage of the contribution of methamphetamine to those crimes, like rape. Let's look at all the people in this society who commit rape. Do the vast majority of the people who commit rape take Shabu? Is that what's going on? I know that's not true. That's just based on the fact that methamphetamine or Shabu is used all around the world, and we don't see these kinds of things.
So you're talking about worldwide studies.
Yeah, worldwide, in the United States, everywhere. But that does not mean that there's not a real concern here. Of course, there is a real concern, but let's focus on the real concern. If the real concern is crime, let's figure out what's going on. One of the things that I know about the Philippines, for example, just like many, and this issue is impacting many people who are poor, limited resources, who have lack of job opportunities, lack of education. All of these kind of things we know drive crime. We know all of these things are closely associated with crime. Let's focus on those things as well, and not just focus on the drug.
The crime, the punishment aspect of.
Well, let's just not just focus on the drugs, because then we miss an opportunity to actually solve the problem.
Right. Well, obviously, one of the issues in the as a part of the drug war is experts are accusing the police of abuse. So, I mean, one of the major issues people have now is the supposed culture of impunity, of violence. Given that that's how a lot of critics are thinking also, how do you insert or how do you assert the public health agenda into that narrative when people are so concerned about the sheer number of deaths, allegations that police are actually behind these summary executions? So how do you...
See, I don't know enough about the
Okay.
deaths and this sort of thing, and so I need to learn more about that before I speak on that
All right.
publicly. I am an expert on the drugs,
Okay.
but the deaths and that sort of thing, I'll leave that to my colleagues who understand that better than me.
Okay. Last question. Moving forward, how do you make science drive policy? I'm sure in other countries it's the same. In the Philippines, it's a very emotional issue.
Yes.
You see on the news, someone gets raped, someone was mugged because supposedly the suspect was high on Shabu or whatever. So how do you do that effectively? I mean, I guess that's the problem people have also here. How do you make sure that our leaders listen to what science says?
I don't know how to make your leaders listen to anything, because political leaders, they tend to listen to the people, the votes. That's what they tend to respond to.
Right.
And so as a result, I think it's important for us to educate the population, the public, on asking the right questions. If we're really worried about our societies, let's ask the right questions. Was Shabu the real cause of this? Do the majority of people who use Shabu, are the majority of those people addicts? So we have to help them to be able to sift through rubbish and focus on what's real. But the focus should be on public education, not, I can't speak for political leaders. I don't know what they respond to.
You mentioned earlier that you actually worked in Thailand to craft, I guess, or to improve their drug policy. But there was a time that they really took the punitive approach, right, for a few months.
Yes.
So what was the turning point? What made them change their minds? I mean, I know last year they already said, they admitted that their war on drugs was a failure. So what happened between 2003, 2004,
Yes.
and today? What made them admit that it's not working?
I think that the evidence was becoming overwhelming.
Okay.
For example, one of the things in Thai law that's happened is that methamphetamine violations were punished 10 times more harshly than heroin violations. What we started to see in Thailand is that people would have one tablet or so, and then they would go to jail for 25, 50 years.
Disproportionate punishment.
And they saw that this was just not fair, and it piled
Okay.
up and it piled up, and many of these people remain in jail. And I spoke with people in the Justice Department, other people about these sort of issues, and tried to help them to understand that it wasn't the drug only. There are other things that we need to focus on, and that most of the people who use these drugs don't engage in those behaviors that we've been told they engage in. And so we started to look at all of the evidence, and then they started to see when people say, for example, that the war on drugs is a failure, that's not entirely true,
Okay.
because the war on drugs still benefits certain people in our population. Like law enforcement gets bigger budgets as a
Okay.
result, and other people get bigger budgets as a result. And so it's not a failure for them.
Okay.
It becomes a failure for other members of our society. So we
Right.
have to be careful with who we're talking about.
To understand the
And-
nuances of
Right,
the things that we
because
say.
if it was a failure, it would not continue as long as it has. We tend to think of it that way because we think that there are more effective ways to deal with drug-related issues.
Right. We have no more questions on social media. I guess I hope everyone listened to what you were saying. You've spent a few days in the Philippines. What would your message be to, especially the science community here,
Yeah.
the people that you say should be able to voice out what they know,
Yeah.
or what the world knows about drugs, drug use?
So the message to the science community will be different than the broader community. The
Okay.
message to the science community would simply be, please have evidence to support your position. Know the evidence, and make sure that they cite the papers that are supporting whatever position they have. That's one. We should require that of the science community. And then as we think about the broader community, the message to the broader community is that they need to understand that drug addiction is not the same as drug use. There are many people who use alcohol, for example, and they don't have an alcoholism or drug or alcohol addiction problem. So think about all of these drugs in the same way. So those are the major messages I hope people take away.
And I hope they actually listen to what you've had to say the past few days that you were here. Thank you for sharing your time again with us. That was Rappler Talk, and I'm Bea Cupin.
Thank you.
Thank you.